Hello, my name's Ben. I'm from the ambulance. What's your name?
Hello, I'm Cheyenne.
Shane, do you mind if I feel your pulse while we have a talk?
Yeah, that's okay.
What's happening today?
I just feel like I'm short of breath.
Okay, alright. Alright, good. Do you mind if I have a seat while we have a talk?
Yeah, that's okay.
So, tell me a little bit about this shortness of breath that you're having.
I don't know, I just feel like it's hard to breathe.
Okay, and is it painful?
No pain.
More of a discomfort?
Yeah, I'd say that.
Okay, so on a scale of 0 to 10, with 0 being no discomfort at all and 10 being the worst discomfort you've ever had, where would you think that discomfort is?
Maybe a 6.
Okay, alright. And is it difficult for you to breathe in, breathe out, or a bit of both?
I think it's both.
Okay. And is the discomfort radiating anywhere else?
No.
No, just
yeah,
just in your chest. Okay, alright. And how long has this been going on for?
Oh, I think this morning, but I think it started last night. It's just, I think today's been worse. So yeah.
Okay, was it worse this morning or was it worse last night?
Worse this morning.
Okay, but not as bad last night.
Yeah.
Okay, alright. And what do you think might have led to this shortness of breath?
Well, last night my boyfriend and I had a fight and he just took off, and I've been trying to call him and he's not answering his phone, and I'm just really worried.
Okay.
I still haven't been able to get into contact with him.
Yeah, okay. So you're a little bit worried, and do you think that might have led to the way you're feeling now?
Yeah, maybe.
Okay, alright. Has anything made it feel better at all? Or sitting up or laying down or anything?
Oh, no. I mean, I tried a puffer.
Yeah.
I have my Ventolin puffer, and it didn't seem to help.
Okay, alright. And does anything make it worse at all?
No.
No? Okay. And how often do these sort of attacks happen?
I don't know, I don't think I've ever experienced this before.
Okay, alright. And how is it affecting you today?
Well, I had to call in sick to work.
Yeah.
So I never made it into work.
Okay, so you've had to take the day off work. What do you do for work?
I just work at this restaurant.
Okay.
Yeah, we're open all day.
Yeah. Are you casual or full-time?
Oh, yeah, maybe part-time. I work when I can.
Oh, okay. Alright,
Yeah.
no problems. And have you tried taking anything for this today?
No.
No?
Not besides my puffer.
Oh, okay. So you haven't tried any other over-the-counter medications or anything that might have been prescribed by a doctor?
No, I haven't taken anything, but I'm meant to when I feel like this, but I haven't.
Okay, and what are you supposed to take?
I'm supposed to take Valium.
Okay, alright, you haven't taken that today?
No.
Okay, alright. Cheyenne, are your parents alive and well?
No, I don't know my parents.
Oh, okay. How's it that you don't know your parents?
I'm adopted.
Oh, okay. Alright, and then was your upbringing at home pretty good?
Yeah, I think so. I mean, I didn't notice anything different.
Okay, alright. And is this your house that we're at?
Yeah,
Okay, and who do you live here with?
my boyfriend
Okay.
and our daughter.
Oh, okay. And is your daughter well?
Yeah,
No genetic problems?
no,
No?
not that we know of.
Okay.
She's a happy little girl, so
Yeah.
yeah.
Oh, that's great. Now, Cheyenne, do you smoke?
No, not anymore.
Not anymore. You used to smoke?
Yeah,
And how much would you smoke when you were smoking?
I'd say pretty heavily, maybe half a pack a day.
Okay. And you've stopped now?
Yeah, I don't do that anymore.
How long ago did you stop?
5 years ago.
Oh, okay, great. And what about drinking? Do you drink?
I mean, maybe socially, but no, I'm not anywhere near I used to be.
Okay. And how many drinks a week do you think you would have on average?
I would, or now?
Now.
Or maybe once a fortnight.
Oh, okay.
Yeah.
So not much at all.
No.
Okay. And what about recreational drugs? Do you use recreational drugs at all?
No, I used to though.
Used to though? Okay. How long
Yeah.
ago was that?
Maybe the same time with smoking. So
Okay.
yeah, I stopped them both at the same time.
And what was the reason for that? I mean, it's great, but I'm just sort of
Yeah.
curious.
Oh, just because I fell pregnant with
Oh,
our daughter,
okay.
so I thought I needed to change my habits.
Absolutely.
Yeah.
Okay, that's great. And now you've mentioned that you're on your Ventolin.
Yeah.
And you take diazepam as well, Valium.
Yeah.
Yeah. Are there any other medications that you take for anything?
No.
Anything over the counter, multivitamins, fish oil, any supplements?
No, I don't take any vitamins or anything like that.
Okay. Are you on the pill?
Yes.
Yes, you are? Okay. And do you have any allergies?
No, I'm not allergic to anything.
You're not allergic to anything?
No.
Okay, no worries. So, Shane, what I want to do is I just want to ask you a few more sort of general questions that will give me just a better overview of, sort of what's going on. Some of them might seem a little bit silly, but just sort of bear with me and answer them best you can.
Okay.
So have you had any fevers or sweats or any weight gain or loss?
No.
Dry mouth, anything like that?
Don't think so.
Don't think so? Okay. With your shortness of breath, have you had any chest pain that might feel like it's stabbing or tearing or crushing or anything strange like that?
No, I don't. No chest pain.
Okay. What about any palpitations or fainting?
Oh, what do you mean?
So has it felt like your heart may have skipped a beat or paused and then it was trying to catch up?
Yeah, I think maybe early this morning when I felt really short of breath.
Yeah.
It felt like maybe I had maybe a third beat or something.
Oh, okay. Has that passed now?
Yeah, I haven't felt it since.
Okay. And have you been coughing anything up? Any blood? Any sputum?
No.
Nothing like that? You haven't had a cough at all?
No.
Have you been wheezy at all?
No.
Okay. Have you had any nausea or vomiting?
Oh, maybe last night.
Yeah. Was it nausea or was it vomiting?
I think I just felt unwell.
You just
again.
felt unwell, but you weren't actually sick?
No, I did never end up being sick.
Okay. Did you have any pain?
No.
Sort of any pain in your abdominal area with that nausea?
No.
No? Okay. And have you been able to open your bowels as you normally would?
Yeah.
No constipation, no diarrhea?
No.
Okay. Have you had any seizures, any funny turns, any sort of visual disturbances or any halos, anything like that?
No.
Any numbness or weakness in your fingers, your hands, your legs, your arms? Any tingling or funny sensations?
No, I don't noticed anything different.
Okay. And what about muscle pain or joint pain?
No, I haven't felt anything different.
No stiffness or swelling in your joints?
No,
Okay.
not that I've noticed.
When you go for a wee, have you noticed that you've had any difficulty starting or stopping or any burning pain?
No, it's all pretty normal.
All pretty normal?
Yeah.
No dribbling or anything strange like that?
No.
Okay. And have you noticed any strange bruises or have you noticed that any of your cuts won't stop bleeding? Any small cuts won't stop bleeding?
No.
No? Any lumps or anything over your body that you've noticed that's a little bit different?
No.
No? Okay. Have you noticed any sort of funny sweating? Just sort of start sweating for no apparent reason?
No.
No? You haven't lost any hair or noticed any swelling in your neck?
No, I don't think so.
Okay. And what about your skin and your skin? Has it looked in it yellow or discoloured at all? Your hair hasn't changed, your nails haven't changed?
No, I don't think so.
No? Okay. And how's your sleep been?
Oh, other than last night. Last night was terrible. I didn't get much sleep at all.
Okay.
But I think pretty well other than last night.
So you sleep pretty normally. Last night you were just a bit upset and a bit worried.
Yeah.
And has your appetite been normal? Have you eaten today?
No, I haven't felt like eating today.
Okay. All right. And do you normally have an appetite?
Yeah, I normally stick to a pretty balanced diet with a few meals every day.
Okay. And how's your mood been lately?
Oh, today I've been feeling really sad and worried
Okay.
and just a bit unsure and stressed. But other than that, I think I'm pretty happy with my daughter and boyfriend, but he's gone now. I don't know what's going on, so.
Okay. And I know that you've said you felt a little bit anxious. Have you had any depression? Have you ever been diagnosed with depression?
No, not depression.
No, you've never self-harmed or had thoughts of suicide? No, nothing like that?
Nah.
Okay, all right. And just one last thing, Cheyenne. Your menstrual cycle, has that been normal?
Yeah, regular, every month.
Yep, no abnormal bleeding?
No, the
No?
pill regulates that.
Okay.
Which is good.
And is there any chance that you could be pregnant?
No, not at the moment.
Okay, great. All right, so what I'd like to do is just a bit of a respiratory exam, just to see if I can figure out a little bit more what's going on with this shortness of breath. So I'll just start with your hands. If you could hold your hands out for me. Okay, so I'm just looking at your hands here, just looking at your nails. Any signs of cyanosis? Just going to squeeze your fingernails there, Cheyenne. And just looking at your cap refill. All right, great. So just turn your hands over for me there. So just looking for any tar staining. Your hands look pretty good. Just any Janeway lesions. Looks pretty good. No xanthomata. Just want to have a feel of your pulses while you've got your hands like that, Cheyenne. You can feel them bounding away. They're nice and regular, nice and strong. All right, that's good. Okay, so next thing I'd like you to do is just pull your eyelids down for me. So I'm just looking for any pallor, any signs of anemia, and just looking for any signs of jaundice. All right, just let go for me. Any sign of Horner syndrome, no drooping. Okay, great. So I just want to have a look at your nose as well. So could you tip your head backwards for me? So just looking for any polyps and septal deviation. Looks pretty good. And Shane, could you just put your head forward and just open your mouth for me? So tongue to the roof of your mouth and open up nice and wide. So looking for any signs of cyanosis, your teeth look good, and just stick your tongue out for me. Have you had a sore throat or anything?
No.
No? No tonsil infections?
No, I don't think so.
Okay, that looks all pretty good. So next thing I want to do is just have a little bit of a look and feel of your neck. Is that okay?
Yep.
All right, perfect. So just head up nice and straight for me. So just feeling at the back for any raised lymph nodes and just working my way down the front. Down to your chin here and just down your neck. You haven't noticed any bumps or any swelling in your neck, have you, Cheyenne?
No.
No? Okay. All right, so the next thing I'd like to do is just have a little feel of your windpipe. It can feel a little bit strange, but I'll be as quick as I can, and if you have any discomfort, just let me know and I'll stop, okay?
Okay.
So chin up for me. So I'm just going to move side to side, just looking for any deviation or tugging. And gaps here is nice and regular. Same on this side here. All right, that's good. Now one last thing I'd like you to do, Shane, is just hold out your hands nice and straight for me best you can. Very good, there's no tremor there. You haven't noticed your hands shaking unusually or anything like that?
No.
And just pull your hands back like this for me. Okay, great. All right, so the next thing I'd like to do is just have a little bit of a look, listen and feel of your chest. So the first thing I'll do is just get you to take your top off for me.
Yeah.
Okay, so have you had any surgeries on your chest, Cheyenne?
No.
No, have you had any surgeries at all?
Oh yeah, a knee one.
Okay, what did you have done to your knee?
ACL replacement.
No complications with that?
No.
Okay.
Good.
And your knee's been okay since?
Yeah.
All right, great. So I'm just having a look. You don't have any scars on your chest. You haven't had any trauma to your chest, have you?
No.
No, just stick your arms out for me there. Okay, perfect. All right, you can pop your arms down. So just shuffle forward a little bit for me on your seat. I'll just get you to sit back as well. So I'm just going to have a feel for the symmetry of your chest. So my hands will just come just underneath your breast and just on your side here. My thumbs will be in the middle. Is that okay?
Yeah.
Cool. All right. So big breath in for me. And out. Did you have any pain when I did that?
No.
No? Okay, I'll just get you to sit forward and I'm just going to do the same thing. So my hands will just be on your side here with my thumbs up the middle of your back.
Yeah.
So big breath in and out. Very good. Okay, and there's no obvious trauma scars or deformities on your back. So I'm just going to have a listen to your back now as well. Is that all right?
Yeah, that's fine.
So just give yourself a big hug. Excellent. All right, so breathe in and out. And in and out. And in and out. And in and out. And in and and in, and out, in, and out, and in, and out. Alright, so I'm just going to have a bit of a tap on your back as well. I just want to have a little bit of a listen. Alright, that sounds good resonance there. Just work my way down. Just listening for any pleural effusion. Alright, great. And just sit back for me, Cheyenne. So I'm just going to do pretty much exactly the same thing but on the front this time. Okay. So breathe in and out. Breathe in and out. And in and out. And in and out. And in and out. And in and out. Okay, your chest sounds nice and clear. So I'm just going to have another bit of a tap on the front of your chest. Yeah. So just below your collarbone here. That sounds great. And just laterally here as well. And just here. Alright, fantastic. Now one last test that I want to do is just test the resonance of your voice. So I'll just put my hands on your front like this and I'll just get you to say E-E.
Yep, sure.
So, E-E.
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 And just sit forward. And same again.
E-E.
Yep.
E-E. E-E. E-E.
Well, that completes my exam, Cheyenne. Thank you so much.
Yep, that's okay.